On March 31st, new hemp regulations went into effect across Texas, banning some popular products while leaving other products largely untouched. What does all of this mean for consumers, businesses, and public health? Welcome to Texas Briefing, where we explain the policy challenges that shape life in the Lone Star State. I'm Ed Emmett, a fellow at the Baker Institute for Public Policy. We're coming to you from Rice University's Baker Institute here in Houston, Texas. The new rules surrounding hemp are already reshaping the market. Today, we'll walk through what is hemp, how has it been regulated in Texas, what's being changed under the new rules, and what does all of this mean for safety, health, and enforcement. I'm joined today by Katharine Harris, a fellow at the Baker Institute. Welcome, Katharine. We're glad you're here.
Thank you, Ed.
Let's start by the basic. Can you briefly explain what hemp is and how it's different from marijuana? How has it been regulated in Texas up till now?
Hemp and marijuana are both species of the cannabis plant, the same species of the cannabis plant. They're legally separated by how much delta-9 THC they have. And so hemp is legally defined as anything with less than 0.3% delta-9, and marijuana is anything with more than that. And delta-9 is the compound that we typically associate with the high that someone might get from smoking marijuana. In 2018, Congress legalized hemp and all of its derivatives, and Texas followed suit in 2019. So from 2019 in Texas until last year, consumable hemp products in Texas were pretty available with very few restrictions on the potency or the form. There were no age limits on sales. The licensing fees were very low. So that was the situation until about last year.
And now what's happened? Why has it changed? Those of us who follow the legislature saw a knockdown, drag-out fight where the lieutenant governor wanted something, the governor wanted something different. Explain all that.
Yeah, so this issue has been on the radar of lawmakers for a few sessions now because the market has grown so much and because of the, I think, very high visibility of hemp stores. So you can't drive around Houston without seeing hemp stores. We have over 9,000 now in the state. And so last year, the legislature, there was a big effort to ban hemp products. It was led by the lieutenant governor and also Senator Charles Perry. The bill that they passed, which would have banned most hemp products, was vetoed by Governor Abbott. Then we had two special sessions where the legislature debated this issue again. They could not reach a compromise. And so in the end, Governor Abbott signed an executive order. That order directed the Department of State Health Services and the Alcohol and Beverage Commission to institute a 21 and up sales limit immediately. And then he also directed the agencies to make rules that would address product testing and packaging and licensing and other kinds of requirements. And those rules went into effect on March 31st.
Okay, you mentioned hemp stores. Are those the same as what we see as CBD stores?
Yeah, so most of the stores that you see that sell CBD is derived from hemp, right? And there's a variety of products there. A lot of those stores, since the market has kind of opened up to these hemp-derived THC products, also sell those. And that is where the majority of sales now come from these THC products.
So THC versus CBD, how does all this tie together?
THC is the compound that causes impairment in higher doses. I mean, very low doses, it doesn't cause impairment. But THC is the thing, when you think about marijuana and people being high on marijuana, THC is the chemical that causes that reaction. CBD, cannabidiol, is a non-impairing compound that's found in the hemp plant. And now you see it in everything. I mean, people put it in their coffee, people give it to their dogs, right, for sleep. I mean, it's everywhere. That compound does not cause impairment. Sometimes the two compounds are in the same product together, but they're different in terms of how they affect the human body.
For people who are using CBD, then these regulations don't have anything to do with them.
Correct, right. So the new rules made by the state do not affect CBD products.
So beyond the products themselves, how does this impact business? Because as you said, you can't drive anywhere without seeing some of these stores. What does it mean to them in terms of licensing, compliance, testing, what products they can sell?
So there are a lot of things for the businesses. I'll start with the licensing fees because this was a big issue for them. Prior to the new rules, a manufacturing license in Texas to manufacture hemp products was $258 a year. To have a retail store, $155 a year. I think those are rates that I think most people would agree are pretty low. So the Department of State Health Services has hiked those rates. They are now $10,000 a year for manufacturers and $5,000 a year for retailers. So this is a pretty big hike. There are also a lot more requirements now as far as packaging goes, right? It has to be child resistant. It has to be tamper evident. You can't have any imagery that appeals to youth. The labeling has to clearly state the amount of THC that's in the product. It has to include warnings. Businesses also have more detailed record-keeping requirements now. They have to keep records for 3 years. They have to consent to inspections from the state. So a lot of these changes in compliance that will add to expenses on top of the licensing fees, while at the same time, the state has now further restricted the kinds of products that they can sell.
For example, I think that's the key question a lot of people are going to have is what is no longer going to be available to purchase at these stores.
And I think that is the biggest question on the consumer side. It comes down to how THC is measured. And if we go back to that definition of hemp is defined as having less than 0.3% delta-9. Okay, that was the definition that we had in Texas prior to the rule change. Now the rule says that hemp products have to have less than 0.3% total THC. Again, delta-9 is the compound that we know most well in marijuana that gets you high, but there are other forms of THC. They're called THC isomers that can also cause impairment. And then there is THCA or THC acid. Now this is a raw acidic form of THC that is found in the cannabis plant before it's heated. Okay, and so by itself, THCA does not cause impairment. But if you smoke it, you vape it, you heat it in whatever way you want to heat it, it converts into that delta-9 compound, which then does cause the impairment. So under the old rules, hemp products just had to have less than that 0.3% delta-9. And so that allowed for the sale of THCA flower and other smokable products that were ostensibly hemp that would show low delta-9 content on paper if tested, but that when consumed would cause impairment. And so that was this big kind of market for hemp flower, for pre-rolled joints.
Now, when you say hemp flower,
yeah,
what are you talking about?
I'm talking about like little flowers, buds of, it looks as like the same as marijuana. So that was a very popular product. You'd see it all over. If you go into any kind of smoke shop, you would see, again, the kind of green flowers, again, that you would normally associate with marijuana, but it's hemp flower. They're the same species of the plant, so they look very similar. And that was a huge portion of sales, and that varies, but some reports show that for some stores, the flower products and these pre-rolled joints made up about half of their inventory. So a very big part of the Texas hemp market were these products that are now no longer going to be available.
Let's talk about age restrictions. What ages were allowed to buy things in these stores before? Has that changed? You mentioned that they can't have marketing aimed at youth, but who can buy what?
That was one of the first things that went into effect last year following the governor's executive order. Prior to that, there were no age restrictions, which meant that theoretically, somebody who was, 11, 12, 13, any age could go in and buy a hemp-derived THC product. There were a lot of stores that voluntarily limited sales to people that were either over 18 or over 21. But you had a lot of other actors that were not doing that. So the new rules finalized the 21 and up restrictions. They require age verification, which just means that in order to buy these products, you have to show an ID, just like you would if you were buying a nicotine product or a alcohol product. And so all of that goes into effect for stores. I should say, though, that the state rules don't do a lot to address online sales. It has partly to do with jurisdictional issues, but you still are going to have the problem of online retailers who are not really verifying the age of their customers and will ship these products, wherever they can.
So these stores, are there still products that they will be able to sell to people under 21 or not?
So not under 21, no.
No products at all, no CBD, anything.
The CBD products depends a bit on the THC, but those it can vary a little bit. But the products with THC, they cannot sell to those under 21.
So the difficult question, what products are still going to be generally available? What's the real impact of this, I guess, is the bottom line.
I think that there is a big impact for consumers, and so far as a lot of consumers did prefer, these flower products. Again, it made up a very large share of the hemp market in Texas. Without those products on the market, I think you're going to see a lot of people who go back to the illicit market, where many of them were prior to all of this, right? They would just buy marijuana on the unregulated market. I think a lot of them will go back to that. Others will probably shift to products that remain legal, which are namely edibles and drinks. And this is where it gets a little bit, I'll explain it as simply as I can. Intoxicating edibles and drinks are still available under these new rules. And the reason for that is because the rule change, I mentioned again, this 0.3% total THC metric that we have now to measure how potent a product is. That is a weight-based metric. Okay, so it depends on the weight of the product. Heavier products, like a drink or like a candy bar, can still satisfy the new threshold and still cause impairment. And the example I give here, if you think about a regular size Snickers bar, that's about 50 grams is about the size of that. THC is measured in milligrams. So you could have a regular size candy bar with up to 150 milligrams of THC that would still be legal in this state. That is a very high dose, can certainly cause impairment, and it's much higher than what you see allowed in recreational marijuana markets in states that have legalized. Most of them cap edibles at 10 milligrams of THC. We do not have that kind of cap here currently. That has not been affected by this rule change. So even though there's no longer flower products or smokable, vapes and that kind of thing, there are still these highly potent drinks and edibles that are available.
I think what I heard you just say is that in an effort to restrict, the governor and the folks in Austin may actually have created this loophole where there are other products that are more potent than the ones that are being banned.
So they didn't really create anything in the sense that these things have been available, but they didn't address it. And part of the reason for that, the state Department of State Health Services was actually sued a few years ago for trying to regulate certain hemp products, and I would suspect that they would tell you that regulating the drinks and the edibles was sort of out of their statutory or their rulemaking authority, and that the legislature needs to address that. So I think that that's probably one reason that it wasn't addressed. But I do think that the restriction, the crackdown on the THCA flower is going to steer some customers to these other kinds of drinks and edible products that are not just intoxicating, but can potentially carry additional health risks because of the chemical process involved in making them.
Recently, I had a conversation with someone in the adult beverage industry, shall we say. This person was bemoaning the fact that beer sales are down among young people. Other alcohol sales are down. And he was attributing it to the fact that the next generation is moving toward these type of drinks that you describe. Do you see that happening? Is that a reality?
I don't think that you can pin all of the decline in alcohol use just to the rise of these THC drinks, because the decline in alcohol use is really a global phenomenon, or at least in Western countries, you can see this declining alcohol use among younger generations. And I think there's a lot of things that can be attributed to that. I think there's this increased focus on wellness. There's been a lot of consistent messaging from the Surgeon General's office, for example, saying that alcohol is not safe in any amounts, that it's linked to these cancers. So I think that there's more to it than just the THC drinks. But certainly, I think that that has cut into that market to a certain extent. I think that there's this perception that that cannabis can be better incorporated into a wellness routine than alcohol, right? And to that point, I think that there's a split within the beverage industry where there are some who are opposing these things because they see it as cutting into their sales. But you have a different component of the beverage industry that is on board with the cannabis drinks and are getting into that market. I mean, we have breweries here in Texas, in Houston, Eighth Wonder, for example, who has a line of THC drinks. So I think it kind of depends on which part of the beverage industry we're talking about, because there's really a split within that group.
Anytime you have an order like this, or regulations, they have to be enforced. What's enforcement going to look like? Will enforcement be only at the business level, or will individuals suddenly find themselves targets of enforcement? How's this going to work?
2 points on that. First, just on the business side, prior to these new rules, the Department of State Health Services was the primary agency tasked with enforcement. And that was a problem because they didn't have the resources to keep track of the 9,000 registered stores. Reordering, restructuring of authority to include TABC is that effort to increase enforcement because TABC has more experience with regulating businesses that are selling an impairing product. And so that's supposed to really help out on enforcing these rules on the business side of things. Now, on the consumer side of things, the rules that were created apply again to businesses, to manufacturers, to retailers. They don't create new criminal penalties for individuals who are just possessing this THCA hemp flower. So in theory, if you're a consumer, you should be able to possess this flower without facing legal consequences. In practice, though, police, they do not have an easy way to differentiate between legal cannabis and illegal cannabis. They just don't, right? It has to be sent to a crime lab. There's a lot that goes into that. And so what enforcement looks like at the individual consumer level is going to depend, I think, very heavily on police discretion. And I think that there's going to be confusion on the ground among law enforcement about what exactly the new rules mean for them. And so if you're someone who is arrested for possessing hemp THCA flower, you might have a reasonable defense there, but I would definitely advise caution on that front, especially if you live in a more rural part of the state.
Well, if that is banned, though, under these new regulations and rules, shouldn't it be assumed that if you have it, you acquired it illegally?
The new rules just went into effect, right? Yesterday. And so people might have products that they've already purchased that they still have. But again, this is where the interpretation, I think that there's still a lot to figure out. The way that the new rules require these products to be tested, you are supposed to be able to differentiate between Delta 9, THC, THCA, and other forms of THC. So if you have hemp flower that is low on Delta 9, you should be able to say, okay, this is hemp THCA flower. It's not technically marijuana. The state has not instituted criminal penalties for this. I should not face legal consequences. You're going to need, I think, a good lawyer to be able to have the resources to help you argue that point. Because, and this is just to add another wrinkle, but the way that the state crime lab tests these products does not differentiate between those things. And so before any of this happened, you already had individuals that were being arrested for things that they bought at state licensed stores, which I find a very big problem, that you have a store that's making money off a product that then somebody is getting arrested for. That, I think, is still something that is an issue in the state and that hasn't really been resolved. And again, I think that we're going to have to see how this plays out. I do think there's going to be confusion about how the law is supposed to be enforced at the individual level.
And when we talk about legal issues to the listeners, this is not a legal, don't take legal advice from the podcast. Okay, so we've talked a lot about the state. Briefly, what's going on in other states? How does Texas compare to those? Because, if somebody can go across the state line and buy a product that's legal there, and the enforcement isn't on the individual here, what's going on in other states and how's it going to impact Texas?
Yeah, so Texas, I would say, is really kind of like right in line with where a lot of other states are, in the sense that many states now are having these similar debates, having these similar reforms that are limiting the types of products that can be sold. I would say that roughly half of states right now still allow impairing products, as Texas does with the drinks and the edibles. But as states are cracking down on these hemp products, they're also expanding access to marijuana. And Texas has done that. Last session, they expanded the compassionate use program, which is the state's medical marijuana program. And I think that this reflects a preference to have, if we're going to allow people to consume THC, to consume cannabis, I think all of this really reflects a preference for a more tightly regulated system than we have had in the hemp space up until now.
And we try to wrap our heads around all of this. What's going to happen next? I mean, obviously there's a legislative session that'll start in January, but legal challenges, legislation, what are you going to be watching?
Yeah, so we'll be watching all of it. I mean, I think that there's going to be multiple developments. Certainly, I think that we can expect some legal challenges to the rules that were just passed at the state level. I think that the legislature in 2027 is going to probably try to address some of the lingering issues as it relates to the drinks and edibles. And then we also have to watch at the federal level. There's a new definition of hemp that is set to take effect in November that would virtually ban all impairing hemp products at the federal level, right? So that would essentially say like no more interstate commerce of these products. Even if that change takes effect, which there's been efforts to delay it or to reform it, it doesn't necessarily affect state laws. And there's a big question about enforcement, because even if we do ban all of these products, the enforcement of that is going to be expensive. And there's a question of whether the federal government would help or if they leave it to the states. And so, again, it's something that we don't really know what it's going to look like just yet. And as far as the marketplace, the market is adapting. It has to adapt to this. And the hope is that we'll see it move towards safer products, more standardized methods of making products. But again, none of that is really guaranteed at this time.
Well, this is going to be a very interesting topic to follow from a business point of view, from a consumer point of view, from a legal point of view, and I guess from a legislative point of view. So, Katharine, we're glad you're here at the Baker Institute monitoring all this for us. So, Katharine Harris, thank you for joining us this morning.
Thanks, Ed, and happy to talk to you.
Texas Briefing is brought to you by the Baker Institute for Public Policy, which provides nonpartisan analysis on the most critical challenges facing the U.S., Texas, and the world. This episode was produced by Shannon Moriarty, with AV production by Kevin Young. Additional support was provided by Leslie Marie Aguilar and Ed Bailey. See our other podcasts, research, and events at bakerinstitute.org. And thank you for joining us.